name's Amber and I'm going to be your student nurse. I'm going to do a head-to-toe assessment on you, but first, before we begin, let me wash my hands. Alright, can you tell me your name and date of birth?
Logan Wynn, February 27th, 1995.
Good, alright. I'm going to check your scalp for any infestations, lesions, or abnormalities, which there are none. Your face is consistent, your skin is consistent in color. There's no lesions, temperature's normal, no diaphoresis, it's dry. I'm going to palpate your sinuses. Please let me know if there's any tenderness or pain. This is the frontal and the maxillary. Next, I'm going to take a look at your eyes. If you'll look up for me, conjunctiva is pink and moist. If you'll look down for me, the sclera is white and moist. Your eyes are symmetrical to your face. Your pupils are also symmetrical. Let's do the light. Alright, can you follow my pen for me? We're going to do the 6 cardinal gazes. Good, and if you will look at my light, look back at the wall, and then look back at my light. You have good accommodation. Your pupils are reactive to light, and they are symmetrical. Next, I'm going to look at your nose. If you'll look up for me. The septum is not deviated. Your mucous membrane is pink and moist. Flare your nostrils. Alright, that is symmetrical. No problems there, no abnormalities. I'm going to check your patency if you'll sniff. Alright, sniff on the other one. Alright, no blockage there, so that's good. Your lips look to be pink and moist with no cracks or lesions. If you'll open your mouth, tongue up, side to side. Alright, your teeth are straight and white. Your cheeks, gums, and tongue are all pink and moist. Your hard and soft palate are pink and moist with no lesions. Your tonsils and your uvula are intact, and they are also pink and moist. Next, I'm going to take a look at your ears. I'm going to make sure there's not any abnormal discharge. Alright, now I'm going to palpate your pinna, which are your ears. Let me know if there's any tenderness. Alright, next I'm going to look at your neck. If you'll look up for me, your trachea is midline to the body, which is good. I'm going to palpate your thyroid to make sure there's no masses. There are none, no abnormalities. I'm going to auscultate your carotid artery with the bell. Your carotid artery is symmetrical on both sides, and there is no bruise. If there was a bruise, that means a stenosis, which is a narrowing of the vessels, and that could mean a blockage. Next, I am going to move on to your anterior thorax. I'm going to look at your skin, and temperature is good, skin is consistent, there's no diaphoresis, your skin is dry. If you'll take a breath for me. You don't use accessory muscles to breathe, which is good, and your rise and fall is symmetrical. Next, I'm going to check your lung sounds. Good. There's no bronchi, wheezing, or crackles. That's normal. And next, have you had a breast examination? Have you ever had one?
No.
Okay, well, it is smart for males and females to do it once a month, especially if breast cancer runs in your family. So I'm going to teach you how to do that. You usually want to do it in the shower laying down, but we're just going to do it right here. If you'll lift your arm up and put it behind your head. And then you're going to start from your axillary and go down, vertical, and then go up and down, kind of like snake. And then you're going to pinch the nipple and make sure there's no discharge. If there is any discharge from the nipple, or there is any masses or enlargements, you need to talk to your doctor. Next, I I am going to check for any visible pulsations, which there are none, so that's good. Next time I'm going to auscultate your valve sounds. In the second intercostal space, just to the right of the sternum, is the aortic valve. Second intercostal space to the left of the sternum is the pulmonic valve. Third intercostal space to the left of the sternum is the Erb's point. Fourth intercostal space is the tricuspid valve. Fourth intercostal space is the mitral valve. And fifth intercostal space is the mitral valve, intercostal space. And then your apical pulse is the fifth intercostal space, mid-clavicular line just to the left. And there was no dysrhythmias or murmurs from your apical pulse. Next, I am going to check your posterior thorax. Your skin is consistent with the rest of your body. Temperature is normal, no lesions. The curvature of your spine is normal. I am going to auscultate your lung sounds. There is no wheezing or bronchi there, which is normal. Next, I'm going to check your upper extremities. Skin is normal in color and consistent with the body. The temperature is normal, no diaphoresis. Skin turgor is normal. If there was turgor, it would be a tinting of the skin, and that would indicate that there is dehydration. I'm going to check your capillary refill. Capillary refill is normal within 3 seconds. I'm going to check your pulse. Radial pulses are symmetrical. Brachial pulses are symmetrical. Next, we're going to check your strength and range of motion. If you'll push up on my hands and push down. All right. Now I am going to check your range of motion. This is abduction, adduction, flexion, and extension. Now I would do that to the other side as well. Next, I'm going to take a look at your abdomen, so if you could lay down for me. All right, if you'll take a breath in and hold it for just a second. All right, you're good. There is no enlargements and no masses, which is normal. I'm going to auscultate your bowel sounds. You usually listen to bowel sounds for 5 minutes, but if you hear them, then you don't have to listen for 5 minutes. I'm going to first listen in the lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. I heard bowel sounds in all 4 quadrants. No abnormal sounds. Now I'm going to palpate lower right, lower left, or upper right, upper left, lower left. There was no masses or enlargements. Next I'm going to go to your lower extremities. Their skin is normal in color, and there is no lesions, and temperature's normal. I'm going to check your capillary refill. Capillary refill is under 3 seconds. I'm going to check your posterior tibial pulse, and that is symmetrical. And your dorsalis pedis, that is also symmetrical. And I'm going to do your strength and range of motion. So if you will, push down on my hands and push up on my hands. All right, and then I'm going to do abduction, adduction, flexion, and extension. And I would do the same thing on the other side. All right, Mr. Wynn, thank you so much. You may now put your shoes on, and we are done with the assessment. Have a good day.